Good morning, everyone. I'm Jeremy, and I shall be kicking off today's forum by introducing to you what heart failure is. I'll be covering the topic through a series of frequently asked questions, covering from what heart failure is, what symptoms heart failure causes, the causes of heart failure, the risk factors for developing heart failure, and then I'll be briefly covering some quick pointers on how to reduce your risk for heart failure. Firstly, what is heart failure? First, let's understand what the heart does. The heart is a pump that supplies and circulates blood around the body. It carries oxygen and nutrients to all your organs. And it also takes away carbon dioxide and toxins from the organs. And then they will eventually be removed from the body through our stool, urine, breathing, etc. The pumping of the blood ensures that the pumping of the heart ensures that the blood is circulating through the body, so the organs can function and we can stay alive. So when the heart fails, the pump doesn't work so well, and the blood is not supplied to the rest of the body. This means nutrients and oxygen don't get to the blood organs. At the same time, carbon dioxide and toxins accumulate in the organ because they cannot get removed. With enough time, this means the organs can stop functioning. This poor blood flow to the organs can cause symptoms such as breathlessness, leg swelling, low blood pressure. And when the organs are unable to withstand the poor blood flow, so they can also stop functioning and cause organ failure. And finally, when the body can't withstand all the toxin and organ failure, the heart will stop beating and the person with heart failure can die. So essentially, in essence, heart failure is where poor heart function leads to poor blood flow that is not enough for the body's needs. And in turn, this leads to complications and death. It's a chronic disease, often lifelong, and it can be life-limiting. And there can be acute episodes, which we call decompensation, that causes symptoms to recur and may lead to hospitalization and even death. It is also important to distinguish the term heart failure from other similar terms. So heart failure is not the same as heart attack or what we call myocardial infarction, which is an acute event where there is a sudden coronary artery blockage that causes the heart to be damaged. It is also not the same as cardiac arrest, where the heart stops pumping completely and may be due to heart problems, such as a severe heart attack, or severe heart failure, or other problems in the body, such as severe infection or blood loss. It is also not the same as a stroke, which is basically a disease of the brain, where there is bleeding or blockage of the blood vessels, the brain. What are some of the symptoms of heart failure? It can cause symptoms such as breathlessness, particularly on exertion or when lying down. It causes leg swelling, chest discomfort, reduced exercise capacity, weight gain from water retention, not fat. And it can also cause other less specific symptoms such as general lethargy or unexplained fainting spells. Do note that there can be other causes for the same symptoms, so it is important to consult a doctor first. So what causes heart failure? In summary, actually, any heart disease can cause heart failure. The most common cause is that of coronary artery disease, where there is narrowing or blockage of the coronary arteries, the blood vessels of the heart, which leads the heart muscle to become weakened and failed. It can be due to intrinsic problems with the heart muscle. It can be due to problems with the heart valves, what we call valvular heart disease. It can be due to heart rhythm issues. It can also be because of congenital heart disease, things such as we often know of hole in the heart. It can be due to infections affecting the heart, or even severe high blood pressure. Do note that high blood pressure is not primarily a heart problem. It actually involves many other systems, but severe high blood pressure can affect the function of the heart. The risk factors of heart failure can be divided into non-reversible, or what we call uncontrollable risk factors, such as age, gender, ethnicity, and family history, or reversible risk factors, or what we call controllable risk factors, such as smoking, high cholesterol, diabetes, high blood pressure, or obesity. It's also important to note that Even if you have none of the above risk factors, it doesn't mean you cannot get heart failure. Just as we say that low crime is not no crime, low risk is also not no risk. In terms of reducing our risks for heart failure, we can all do some simple modifications to our lifestyle first. Things such as regular exercise, having a healthy diet, ensuring a healthy weight, and stop smoking if we are smoking. In addition, we should also screen ourselves regularly for medical conditions that could predispose us to heart failure. And if we have these conditions, we should aim to control them as best as possible, including through the use of medications if necessary. How much should we exercise? We often recommend 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise. Moderate intensity exercise is basically exercise where you can talk and hold short conversations, such as brisk walking, light cycling, dancing, etc. But intense enough that you are able to, say, sing during the exercise. Rigorous intensity exercise, on the other hand, is where it is difficult to talk more than a sentence. So these can be things like jogging, running, climbing stairs, playing football. This is recommended to be done in a week and does not need to be done in one session. It can be done across a few sessions. In terms of diet, we encourage people to eat more whole grains, protein, fruit and vegetables, and to choose healthier oils and fats. At the same time, to eat less salt and sodium, sugar, excess calories, and trans and saturated fats. The Health Promotion Board has come up with this My Healthy Plate, which kind of summarizes all these things, as you can see in the center. The Health Promotion Board also has an excellent website that goes through the various ways to eat healthy, which you can access through this and QR code. In terms of our target weight, the target BMI for Asians is less than 23. Do note that this is different from the rest of the world, which is less than 25. This is important because sometimes if you search information on obesity on the internet, you may often find the cutoff of 25. Do note that this is only applicable for non-Asians. This is because Asians tend to accumulate more body fat for the same body weight compared to other ethnicities. So that makes us higher risk of medical problems from obesity at the same weight. So we all need to try a little harder to maintain a healthy weight. How much should one smoke? 0. If possible, don't smoke at all. Even smoking one stick a day increases the risk of heart disease by almost 50% compared to a non-smoker. Therefore, 0 is the best number. If you or somebody you know are facing difficulty quitting smoking, you aren't alone out there. There are many others that also face this. And because of this, there are programs created by the Health Promotion Board to help you quit smoking effectively, but also comfortably. And why should we go for health screening? It's recommended to all men and women aged 40 years old and above. And where it's related to the heart is that it screens for controllable risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes. And also at higher ages, these health screening programs also screen for cancer, but it's not so relevant for this part. If these risk factors are diagnosed, you can start treatment early before you start to develop problems from it. The best time to screen is when you're still well and before there's time for damage to occur. By the time you wait until you feel unwell, the damage is already done and may be difficult to reverse. And also important to remember is that just because you don't check doesn't mean you don't have it. Ignorance is not bliss. If you actually have a risk factor but don't screen for it, you're allowing time for damage to take place, and it may eventually be too late to reverse the damage when it does occur. So in summary, early detection is early treatment and control, which means a lower risk of heart disease and more years of good luck. As part of Healthier SG, the government has also a screening program with heavily subsidized health screening for all individuals, and it's also free for some people as well. I strongly encourage everyone to take advantage of this if you have not already. You can access it by this QR code and link. And finally, some people may ask, do I need to go for heart screening right now? In general, if you have no symptoms or significant family history of heart disease, we do not recommend going for heart-specific tests, such as treadmill tests, CT scans, echo, and so on. This is because there's no evidence that screening with heart-specific investigations in people with no symptoms or family history can improve survival quality of life. There's also a chance of indeterminate finding, which may lead to unnecessary and invasive tests and also anxiety. The primary focus and the primary benefit to reduce the risk of heart disease, and the primary way to reduce the risk of heart disease is on detecting and controlling your risk factors rather than performing further investigations when they're not necessary. Thank you for your attention.